My name is Travis Wu. I have prostate cancer. I was doing my annual checkup when the blood test came back. Internals at the time, she said, "Oh, your PSA number get a little higher." And then she said, "Oh, don't worry. Let's wait until next year to see if it continue go higher." I went to do an annual blood test again, and this time the number continued go up, and so that she suggested me to go see a urologist. I did consult with the Dr. Hilborn and say, this is the third year my number went up for my PSA number, and then I asked, about his opinion.
I'm a friend of his. We've been friends for many years, and he asked me, what does that mean? And of course, I A, didn't want to be alarming, and B, because there can be both cancerous and non-cancerous diagnoses associated with it, I recommended, in concert with the recommendation that she made, to refer him to a urologist.
They suggest me to do a biopsy right away. The report came out that it was negative, so they didn't find anything.
I actually reviewed those slides and agreed with their pathologist's determination that there was nothing there. But after that, I suggested that, in fact, we do another PSA to see whether, in fact, there were changes. And, in fact, there were changes. The PSA was continuing to go up despite the negative biopsy.
So Travis is a good example of a triumph of the lab over other aspects of our interaction with patients. This all happened before I met him. But when I got to meet Travis, the first thing I did was look through the prior lab results. The fact is that he had had a slightly elevated abnormal lab test that was appropriately followed up, and the biopsy was negative. In almost all cases, that would have given everyone a sigh of relief, and one would have been put into a more dormant mode in patient care. Luckily, in this case, that wasn't the response.
We actually started with a prostate MRI, so an imaging test that actually identified a potential cancer on the top part of the prostate. So this is the area of the prostate that is not routinely biopsied and we can't really feel on exam. But based on this imaging, then we did a test where we fused the biopsy with the imaging result, and we specifically biopsied that area. And that's where we sent it off to the pathologist, and the pathologist identified his prostate cancer. So fortunately, we found that his cancer was entirely contained within the prostate, but it was actually considered a very high risk with elements of what we call Gleason 5, which is the most aggressive form of prostate cancer.
And the only reason that that was detected was because of persistent evaluation of minor changes in lab tests.
Surgery is one of the major treatment options, and the other treatment option is radiation. So for him, we discussed the risks and benefits of these options, ultimately deciding on surgery. When we looked at the entire specimen, showed a much more aggressive cancer than the original biopsies did.
Travis has had his surgery, his PSA is undetectable, and luckily the next steps are for him to be healthy. He certainly needs to be monitored, but the expectation is not that there's going to be recurrence of this malignancy. We can either get complacent or be overly focused on lab tests. And that's really the merging of clinical medicine with laboratory medicine to use lab tests appropriately, exactly when they're needed, and interpret them appropriately. But you can only do that if you have complete trust in your lab. The amount of collaboration that occurs between a surgeon, a urologist in this case, and an internist is extremely high, and it's very frequently guided by the test results received from the laboratory.
It's a very, very strong collaboration we have with our laboratory as well as pathology. If I think of all the times I'm looking for pathology or getting lab tests, it's really essentially for every single patient.
So as pathologists and laboratory professionals, we do hundreds or thousands of tests every day. And it's important for us to realize, and we do, that every specimen represents a patient, a person with a life and a family and friends.
The lab had really saved my life. I found out early enough, due to everybody's work, that now I'm safe, cancer-free, healthy, and happy.